High blood pressure is a common health condition that affects millions of people worldwide. It can lead to serious complications such as heart disease, stroke, and kidney failure. Fortunately, there are several medications available that can help manage blood pressure levels and reduce the risk of these complications. One such medication is Nebivolol, which has been gaining popularity among doctors and patients alike. In this video, we'll explore the many benefits of Nebivolol and how it can help people struggling with hypertension. How does Nebivolol work? Nebivolol is a beta blocker that works by slowing down the heart rate and reducing the workload on the heart. This leads to a decrease in blood pressure levels. Unlike other beta blockers, Nebivolol also has a unique mechanism of action that involves stimulating the production of nitric oxide in the body. Nitric oxide is a naturally occurring molecule that helps to dilate blood vessels and improve blood flow. By increasing the production of nitric oxide, Nebivolol can help to relax blood vessels and further lower blood pressure levels. Nebivolol is available in tablet form and is usually taken once a day. It's important to take Nebivolol exactly as prescribed by your doctor. Do not stop taking Nebivolol without first consulting your doctor, as suddenly stopping this medication can lead to serious complications. Benefits of Nebivolol for blood pressure management. Nebivolol is highly effective in lowering blood pressure levels, with studies showing that it can reduce both systolic and diastolic blood pressure. In addition to its blood pressure lowering effects, Nebivolol has several other benefits for people with hypertension. Improves heart health. By reducing the workload on the heart, Nebivolol can help to improve heart health and reduce the risk of heart disease. This medication has been shown to improve left ventricular function, which is an important measure of heart health. Nebivolol may also help to prevent the development of heart failure in people with hypertension. Reduces anxiety. Hypertension can be a stressful condition, and many people with high blood pressure also suffer from anxiety. Nebivolol has been shown to have anxiolytic effects, meaning that it can help to reduce anxiety levels. This can be especially beneficial for people who experience anxiety-related symptoms such as palpitations, sweating, and tremors. Enhances overall quality of life. Nebivolol can help to improve overall quality of life for people with hypertension. By lowering blood pressure levels and reducing the risk of complications, Nebivolol can help people to feel better and more in control of their health. This can lead to improvements in mood, energy levels, and overall well-being. Nebivolol versus other blood pressure medications. Nebivolol is just one of many medications available for the management of hypertension. So how does it compare to other blood pressure medications? ACE inhibitors. ACE inhibitors are a class of medications that work by blocking the production of angiotensin II, a hormone that causes blood vessels to constrict. Like Nebivolol, ACE inhibitors can help to lower blood pressure levels and improve heart health. However, ACE inhibitors can cause side effects such as coughing, dizziness, and headaches. Nebivolol is generally better tolerated than ACE inhibitors and is less likely to cause these side effects. Calcium channel blockers. Calcium channel blockers are another class of medications that can help to lower blood pressure levels. They work by blocking the entry of calcium into the heart and blood vessels, which leads to relaxation of the blood vessels and a decrease in blood pressure. Calcium channel blockers can cause side effects such as constipation, dizziness, and headaches. Nebivolol is generally better tolerated than calcium channel blockers and is less likely to cause these side effects. Beta blockers. Beta blockers are a class of medications that work by slowing down the heart rate and reducing the workload on the heart. Like Nebivolol, beta blockers can help to lower blood pressure levels and improve heart health. However, beta blockers can cause side effects such as fatigue, dizziness, and sexual dysfunction. Nebivolol is generally better tolerated than beta blockers and is less likely to cause these side effects. Side effects of Nebivolol. Like all medications, Nebivolol can cause side effects in some people. The most common side effects of Nebivolol include 1. Headache. 2. Fatigue. 3. Dizziness. 4. Nausea. 5. Insomnia. These side effects are usually mild and go away on their own. However, if you experience any severe or persistent side effects, you should contact your doctor immediately. Who should take Nebivolol? Nebivolol is typically prescribed for people with hypertension who have not been able to control their blood pressure levels with lifestyle changes alone. It may also be prescribed for people with other conditions such as heart failure, angina, and arrhythmias. Nebivolol may not be suitable for everyone. Your doctor will take into account factors such as your medical history, current medications, and other health conditions before deciding whether Nebivolol is right for you. Dosage and administration of Nebivolol. Nabivilol is usually taken once a day, with or without food. The recommended starting dose is usually 5 mg per day, but this may be increased to 10 mg per day if necessary. Your doctor will determine the right dose for you based on your individual needs and response to the medication. It's important to take Nabivilol exactly as prescribed by your doctor. Do not take more or less of this medication than recommended, and do not stop taking it without first consulting your doctor. Precautions while taking Nabivilol. There are some precautions that you should take while taking Nabivilol. These include: 1. Avoid drinking alcohol while taking Nabivilol, as this can increase the risk of side effects such as dizziness and fatigue. 2. Tell your doctor if you are pregnant or planning to become pregnant, as Nabivilol may not be safe for use during pregnancy. 3. Tell your doctor if you have a history of asthma or other respiratory conditions, as Nabivilol may worsen these conditions in some people. 4. Tell your doctor if you are taking any other medications, as Nabivilol may interact with certain medications and increase the risk of side effects. Frequently asked questions about Nabivilol. Can Nabivilol be taken with other blood pressure medications? Nabivilol can be taken with other blood pressure medications, but it's important to discuss this with your doctor. Your doctor will determine the best combination of medications for your individual needs. Can Nabivilol be used to treat other conditions besides hypertension? Yes, Nabivilol may be used to treat other conditions such as heart failure, angina, and arrhythmias. However, it's important to discuss this with your doctor to determine whether Nabivilol is right for you. Does Nabivilol cause weight gain? Nabivilol is not known to cause weight gain. However, some people may experience changes in appetite or metabolism while taking this medication. What is hypertension? Hypertension is a chronic medical condition characterized by abnormally high blood pressure levels. Blood pressure is the force exerted by the blood against the walls of the arteries as the heart pumps it around the body. A normal blood pressure reading is typically around 120/80ths of a millimeter of mercury. However, when the blood pressure consistently exceeds 130/80ths of a millimeter of mercury, it is considered elevated or hypertensive. Causes of hypertension. Several factors can contribute to the development of hypertension, including lifestyle choices. Unhealthy lifestyle habits such as a sedentary lifestyle, poor diet, high in sodium and low in potassium, excessive alcohol consumption, smoking, and chronic stress can increase the risk of developing hypertension. Family history. Individuals with a family history of hypertension are more likely to develop the condition themselves. Genetic factors can play a role in how the body regulates blood pressure. Age. Hypertension becomes more prevalent with age. As individuals get older, the blood vessels become less flexible, making it harder for blood to flow smoothly and increasing the risk of high blood pressure. Underlying health conditions. Certain medical conditions, such as obesity, diabetes, kidney disease, and sleep apnea, can contribute to the development of hypertension. Symptoms of hypertension. In most cases, hypertension does not present noticeable symptoms, which is why it is often referred to as the silent killer. However, some individuals may experience symptoms such as headaches. Recurrent headaches, particularly in the morning, can be a sign of high blood pressure. Blurred vision. Hypertension can affect the blood vessels in the eyes, leading to blurred vision or vision changes. Chest pain. Severe hypertension can cause chest pain or tightness. Shortness of breath. Difficulty breathing or shortness of breath may be experienced during physical exertion. It is important to note that these symptoms can be indicative of other health conditions as well. Therefore, it is essential to measure blood pressure regularly to accurately diagnose hypertension. Effective management of hypertension. While hypertension is a chronic condition, it can be effectively managed with a combination of lifestyle changes and, in some cases, medication. Here are some key strategies for managing hypertension. Healthy diet. Adopting a balanced and heart-healthy diet is crucial in managing blood pressure. This includes reducing sodium intake, consuming plenty of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Regular exercise. Engaging in regular physical activity, such as brisk walking, jogging, cycling, or swimming, can help lower blood pressure. Aim for at least 150 minutes of moderate-intensity aerobic activity per week. Weight management. Maintaining a healthy weight or working towards weight loss can significantly improve blood pressure control. Even a modest weight loss of 5 to 10% can have a positive impact. Limit alcohol and quit smoking. Excessive alcohol consumption can raise blood pressure, so it is important to moderate alcohol intake. Smoking, on the other hand, damages blood vessels and can worsen hypertension. Quitting smoking is highly recommended for overall cardiovascular health. Stress management. Chronic stress can contribute to hypertension. Exploring stress-reducing techniques such as deep breathing exercises, meditation, yoga, or engaging in hobbies can help manage stress levels and lower blood pressure. Medication. In some cases, lifestyle changes alone may not be sufficient to control hypertension. In consultation with a healthcare professional, medication may be prescribed to help manage blood pressure effectively. Commonly prescribed medications include diuretics, ACE inhibitors, beta blockers, calcium channel blockers, and angiotensin receptor blockers. Monitoring blood pressure. Regular monitoring of blood pressure is essential for individuals struggling with hypertension. This can be done at home using a home blood pressure monitor or through regular checkups with a healthcare professional. Monitoring allows for timely detection of any fluctuations or changes in blood pressure levels, ensuring prompt adjustments to treatment plans if necessary. Hypertension is a prevalent and serious medical condition that requires proactive management. By understanding the causes, recognizing the symptoms, and implementing effective management strategies, individuals struggling with hypertension can regain control over their health and reduce the risk of complications. Lifestyle changes, including a healthy diet, regular exercise, weight management, stress reduction, and, if needed, medication, are all key components of an effective hypertension management plan. Remember, early detection, regular monitoring, and proactive intervention are the keys to successfully managing hypertension and leading a healthier life. If you suspect you have hypertension or have been diagnosed with the condition, consult with a healthcare professional for personalized guidance and support. Nabivilol is a highly effective medication for the management of hypertension. It works by slowing down the heart rate and reducing the workload on the heart, leading to a decrease in blood pressure levels. In addition to its blood pressure lowering effects, Nebivolol has several other benefits for people with hypertension, including improvements in heart health, anxiety reduction, and overall quality of life. Nebivolol is generally well tolerated and has fewer side effects than other blood pressure medications. If you're struggling with hypertension, talk to your doctor about whether Nebivolol is right for you. Thanks for watching.